Hello, my name is Tyler and welcome to our third video on what is therapy. Today we will be discussing fall prevention and fall safety. After this video we will have an understanding on what a fall is and how being fearful of falling affects our daily lives. We will also understand some risk factors that may affect falls and how we can take action towards preventing falls. Lastly, we will understand how therapy can help prevent these falls from occurring. Let me start off by asking a question. Are falls preventable? Yes. Falls are largely preventable, and hopefully you will know how by the end of this video. A fall is defined as a landing on the ground or some lower surface when you did not intend to. Falling includes slipping, tripping, or even lowering yourself to the ground. It is still considered a fall if you did not injure yourself. Basically, anytime you end up on the ground or a lower surface when you didn't want to be there is a fall. Fear of falling. It's an emotion that can last a long time and may affect many of the activities that you do. Sometimes it can keep you from the things that you love to do. Fear of falling can also increase your risk of falling in the future. When people are fearful of falling, they sometimes participate less in meaningful activities and tasks. When you stop doing many of the activities that you used to do, you become weaker. Participating in less activities may also cause you to become less social with friends and family, which may increase your risk for depression or sadness. As you can see, the fear of falling can become a barrier to many of the things that you enjoy doing. In therapy, it is our job to work with you to help you overcome this barrier. There are many risk factors for falling. These include physical, behavioral, cognitive, and environmental risk factors. I'll go into all four in more detail. Physical risk factors may involve changes in your body that may cause falls. Sometimes these include muscle weakness, decreased flexibility and balance, or pain. Behavioral risk factors involve things that we do or do not do, which increase our risk of falling. These may include not reaching back for a chair when sitting down or not pushing off from a chair when standing up. Environmental risk factors are hazards within our own home. These consist of tripping hazards such as loose cords or loose carpet. Environmental risk factors may also include not having grab bars around your toilet or shower. Lastly, cognitive risk factors include how safe we feel in our own home and also how fearful we are of falling. There are risk factors that we can change and others that we cannot. It is important to accept and adapt to the risk factors that we are unable to change in order to prevent falls. It is also important to focus on preventing and correcting the risk factors that are within our control. Risk factors that we can control are our physical activity, our home environment setup, your positive attitude, and following through with therapy and doctor appointments. Exercising for at least 16 minutes per day has been shown to greatly improve your balance and help prevent falls. You can also visit with therapy services here at Compass Park to set you up with a personalized exercise program. You can also make sure you are reviewing your medications with your doctor on a yearly basis. A lot of physical changes may happen over the course of a year. Going to a yearly physical with your doctor as well will ensure your medications are up to date. You should also have your vision checked yearly. Compass Park offers vision testing every Tuesday in the skilled nursing facility with an appointment. You can call IL Social Services to make your appointment. Making your home safer can also help prevent falls. Ask for a visit with therapy services to assess your home. The therapy team may suggest changes to improve your participation in meaningful tasks and help you prevent falls. A physical risk factor that not many people consider is their blood pressure. Low blood pressure may cause you to feel faint and have a fall. When we change body positions from lying down to sitting up to standing upright, we need to give our body time at each stage before moving on to the next. This allows your blood pressure to adjust itself so we do not feel faint when we stand up. Quickly changing body positions from each stage to the next very rapidly will drastically lower your blood pressure. What this may look like is taking a 1 to 2 minute break at each stage before moving on to the next stage. When you're upright out of bed, make sure you take another 1 to 2 minute break before you start to walk. This is so you have the safetiness of your bed or chair behind you in case you do start to feel faint when you stand up. These guidelines for fall prevention are all aimed at helping you stay safe in your home for as long as possible. I recommend starting small with your fall prevention steps. First, make an appointment with your doctor to discuss your current medications and make sure they are up to date. Once your doctor has perfected your medications, request an appointment with the therapy team to provide you with an individualized fall prevention program. If you have concerns with your vision, again, an eye appointment should be scheduled. If a fall does happen to occur, the first thing you need to do is check for injuries. Always wear a device that alerts if you have fallen, such as a life alert. If you do not own a life alert, I recommend investing in one, but also keep your phone on your person at all times so you may call someone if you're unable to get up from the floor on your own. If you hit your head or are unable to get up, immediately call for medical attention with your phone or your medical alert device. In therapy, if you are having trouble getting up from the ground on your own, physical therapy services can provide education and techniques to safely and effectively get up from the ground. We now understand how a fall is defined, as well as common risk factors for falls. We understand that fear of falling is a common roadblock for people who have fallen, but as therapists, we can help you overcome this. We now understand that we are able to conquer the risk factors that we can change and adapt to those that we cannot. We understand that therapy will be able to help create an individualized exercise and fall prevention program. Lastly, we understand how to respond if we do have a fall. That is all for this video. In the next video, we will be discussing how therapy services assists with pain management.